Just a little bit. Jeff, thank you. The Centers for Disease Control and Prevention announcing some policies and practices surrounding treating chronic pain patients were inconsistent with its recommendations. The CDC guidelines were released in 2016, allegedly changing the way the doctors were prescribing patients. Fox 25's Erica Stanish, you got your back on what this means now for patients moving forward. Erica.
Well, Mike, last week, the CDC announced some of its policies that cite the 2016 guidelines were inconsistent with and go beyond its recommendations, leaving some patients struggling for years.
I am doing so much better. Good. I am back to 75% of my life right now.
Tamara Stewart, a chronic pain patient, says she's been struggling for years with an unidentified autoimmune issue. In 2016, when new CDC guidelines were released, Stewart says her life quickly changed.
I gained more weight, was less active, able to do less things with my family.
A release last week by the CDC now breaking down a misapplication of those guidelines.
Yeah, the guidelines were put out to kind of give us some guidance. They're not fast rules.
They always wanted the doctors to be the ones to make the decisions for their patients.
Some misinterpretations suggesting not to discontinue opioids for patients already prescribed at higher dosages, or not to abruptly taper opioids.
10 years ago, people used to write pain medications because they were told to, as a fifth vital sign. But now the pendulum's kind of moving the other way. And so a lot of physicians were scared. I think that, everything will kind of calm down and plane out.
The CDC says it encourages physicians to continue to use their clinical judgment and base treatment on what they know about their patients, saying doctors should consider the use of opioids only if the benefits outweigh their risk.
I think it's going to save a lot of lives just on the suicide version of it, on suicide of it. There's going to be a lot less suicides. I think that's going to help.
Keep that in mind. Try to treat patients fairly, but definitely have a reason for what you're doing.
Christensen says patients can make sure they're seeing a board-certified physician in pain medicine by simply going online to the American Board of Anesthesiology and looking up their doctor. We have a link to that on our website. Mike?
Erica, thank you. We also have the latest release by the CDC posted on our website about the guideline misinterpretations. You can head over to okcfox.com to get some more information on that. Well, a man has